The hospital industry may be stepping up to the plate in its negotiations with the White House, close to agreeing to a cut of $150 billion over the next decade to help pay for health care reform. Bloomberg's Peter Cook is in Washington with more on that story this morning. Peter?
Eric, first it was the drug industry and then Walmart offering concessions to the Obama administration to try and make health care reform happen. Now it appears to be the nation's hospitals poised to cut a deal with the White House that would result in Medicare and Medicaid payment cuts for hospitals over the next decade. Now, for more on what this could mean to this overall debate, we bring in one of the nation's authorities on health care spending, Princeton economics professor Uwe Reinhardt. He's served on a range of government health care panels, been an advisor to lawmakers and to the World Bank, among others. Professor Reinhardt, welcome back to Bloomberg. Thank you for the time. And hospitals are a big target in this health care debate because they account for such a big slice of health care spending. Is that right?
Yeah, it's about 31% of total health spending is hospitals. And that adds up now, for example, to something like $800 billion is the total tab hospitals collect as revenue.
So right now, if we're looking at the figure being tossed around here in Washington, $150 billion over 10 years, this agreement to cut subsidies to those hospitals, how big a deal would that be to the industry?
Well, the industry over the next 10 years is expected to receive about $11 trillion. So $150 billion is a little bit more, so maybe 1.3%. Reduction in expected revenue. Mind you, that revenue is expected to grow about 6 to 7% per year. So it's better than nothing, but it's nothing that will be very difficult for the industry to swallow.
Yet we do hear that these negotiations have been tense at times. The big issue, as we understand it, the payments the government makes to hospitals for caring for the uninsured and also the poor. If health care reform happens, the logic here is that those payments aren't necessary because a lot of people are now covered.
Yes, it's called disproportionate share, meaning a hospital that has a disproportionate share of uninsured or Medicaid patients gets money through the back door from government. And if there are fewer uninsured, therefore the hospital should get less dish money. That's really not a sacrifice on their part. It's just simply money they shouldn't get because people are now insured. So I don't call that a give back.
Professor Reinhardt, is it fair to say that the hospitals are concerned that maybe this healthcare reform effort doesn't happen or it's not that successful in covering a lot of those Americans who aren't covered right now? They want this staggered over time. That's reasonable, is it not?
I think that's a reasonable request. They want it's basically the cuts come in step with increases in insurance. That should be very easily monitored. So their requests say, don't cut us, and then say, we'll promise we'll cover the uninsured. That will be unfair, of course. It should be really step and step. Actually, I would even say lag, that if this year the uninsured fell, next year the dish money should be lower.
Let me ask you about another aspect of this debate and the role hospitals are playing in all this. The Medicare Payment Advisory Commission. Remind our viewers why that institution is so important. The president has essentially proposed that that commission take over a greater role in determining the payments to hospitals going forward instead of Congress?
I think it's a wonderful commission. I served on it for 9 years in its earlier version. It's a group of stakeholders. Hospitals are at the table. Business people are at the table, some policy wonks like myself, and they kind of look at the entire situation and make a recommendation to Congress. And then usually Congress very often ruins the game by not passing very sensible recommendations. In Germany, they have a body like that that makes rules that are binding, and what President Obama is talking about is essentially a similar approach where that body, which is a bunch of citizens, very reasonable, would make a binding rule on payment or other rules. I think that'll come, and you can study how that works in Germany. It works very well there.
We've got the drug industry first offering concessions. We mentioned Walmart as well. Now the hospitals apparently are in line, or at least close to an agreement with the White House. That still leaves the insurers without a specific deal. How important is that agreement? Do you expect it to happen?
Well, of course, the insurers, they don't really deal. President Obama has already said he will take back the 14% extra subsidy they're now getting for Medicare. That's about $177 billion. He'll take that back. There isn't really anything else the White House can get from them other than just not paying them as much. But that's 177 the president can pretty much take, or the Congress if they want to. So that all adds up to eventually you get something like $900 billion in promised savings that the Congressional Budget Office then has to view as almost cash in the bank, even if it isn't.
All towards the effort to get health care reform paid for. Dr. Reinhardt, thank you very much for the time. Appreciate you joining us. Uwe Reinhardt of Princeton University.